Muy buenas tardes, esperamos que hayan tenido un excelente almuerzo. Los invitamos a visitar la feria y el mural virtual que en este momento les vamos a presentar. Allí van a encontrar un QR para que ustedes puedan disfrutar de este espacio que ha sido creado para que ustedes conozcan más acerca de la navegación, más acerca de las alianzas que hay en este momento desde la navegación de pacientes. Bienvenidos nuevamente y vamos a dar paso al video y para que ustedes tengan la posibilidad de tomar el QR para explorar la feria.
Navegación de Pacientes Internacional, NPI, y la Pontificia Universidad Javeriana te dan la bienvenida a la feria virtual del segundo Congreso de Navegadores de Pacientes en Latinoamérica. Conéctate desde donde estés. Explora, aprende y comparte con expertos de toda la región. Descubre instituciones, proyectos y recursos dedicados a la navegación del paciente. Te esperamos en la feria virtual. Conéctate al cambio.
Muy buenas tardes, invitamos a las personas que se encuentran fuera del auditorio para que ingresen. Les damos la bienvenida a las personas que están en conexión remota.
Good afternoon. We welcome everyone who's logged in remotely.
A continuación,
ask you to
tendremos el conversatorio titulado Capacitación y
we ask you to
Certificación
open
para
your
navegadores
cameras.
de pacientes en español. Para esto nos
For
acompaña
this
la
next
doctora
panel, we will have Mandi Pratt-Chapman, Director of the Navigation Program of the George Washington Cancer Center in the United States. She's
en la Universidad Javeriana.
here
Adelante,
in
doctora.
Javeriana University. Doctor.
Oh, okay. You're putting it out. Thanks for coming back after lunch. All right. I'm back again, Dr. Mandi Pratt-Chapman. I am here to talk to you about navigation training. And I'm really, really thrilled to be here to share this with you. I'm going to walk through how our training was developed, some recent updates, and ways that you can access this material. If I know how to use the clicker. Let's see. I might have messed it up. Yeah. Oh, should it work now? See. Nope. I guess next slide. Okay. If you can move that forward. Yeah. Let's see. Okay. So my next slide is a disclosure. The funding for our training came from our Centers for Disease Control and Prevention. Oh, great. But anything I say may not reflect their views, just letting you know that financial disclosure. And I'm just curious, how many people in the room are familiar with our oncology patient navigation training or have seen this page before? 1, 2, maybe? Over here. Okay, so in 2015, we launched our patient navigation training, and so it's been 10 years. And I'm going to walk you through what we did to develop that training, but it has now been more than 10,000 people now have enrolled in this training over 48 countries. And so I'm pretty proud of that. What we did when we got started was, first we wanted to develop core competencies so that we could really base the training on what a navigator should be doing. And competencies are helpful for people who are giving you money, whether that's grant makers or your leadership at your institution, payers in a more traditional sense, policymakers. So that was kind of why we wanted to create competencies. They didn't exist. And what we did was we were very collaborative in trying to develop our competencies. So we collaborated with the Academy of Oncology Nurse and Patient Navigators, the Oncology Nursing Society, the National Association of Social Workers, the Association of Oncology Social Workers, the Association of Community Cancer Centers, as well as patient navigators and community health workers that were doing the work. And these were our phases. I have to go to the English, so I apologize. We formed a committee initially, and what we did was look at the community health worker curricula and known navigation-related curricula and mapped everything onto a huge Excel sheet, and then collapsed domains and tried to deduplicate what we saw. And ultimately, we did a survey with a couple of hundred of patient navigators to see which competencies were endorsed, and if we did let some of those go. We then created a framework that generally described the competencies over major domains. And then we developed and validated the actual final statements, and those statements were the foundation of our 2015 training. And I'm not going to read all of these, but these are the high-level domains that we categorize competencies into. And at the time, I remember very strongly, I wanted to align our competencies with the domains of what's known as the American Council of Graduate Medical Education, because our physician and nurse competencies are aligned with those domains. So we chose domains that would align with those other professional roles in order to distinguish this from other existing and established roles. Okay, and so these are the major categories that we ended up with in terms of domains: ethics, qualifications, knowledge, cultural and linguistic humility, interdisciplinary and interorganizational collaboration, communication, professional development, supervision, mentorship and leadership, self-care, and prevention. And sorry, that didn't align quite well. Okay, and one of the most exciting things is, it was mentioned a couple of times today that on January 1st, 2024, our Office of Medicaid began accepting billing for patient navigation. So for individuals who are 65 and older, which, cancer is a disease of the aging, so a lot of people who are older in the US have Medicare, are eligible, institutions that treat them are eligible for reimbursement now. However, it states in the rule, the payment rule, that in order to bill for these services, a navigator needs to be trained. And the training has to include competencies of patient and family communication, interpersonal and relationship building, patient and family capacity building, service coordination and systems navigation, patient advocacy, facilitation, individual and community assessment, professionalism, ethical conduct, and the development of an appropriate knowledge base. So when this came out, I spoke to several people and I said, well, we have a training that already meets those categories. And they said, well, how did you do that if this was a rule in 2024 and your training came out in 2015? And the answer to that is that we went to the literature. So our training was based on the evidence that was available, and so was the policy rule. So while some words might have differed, our content largely aligned with what was required. And this is kind of little font, but for those in the US that have a lot of competing and standards and developing standards, this is a bit of a crosswalk between the competencies that we published in 2015, the CMS requirements that were published for training in 2024, and the professional oncology navigation standards that AONN published in 2022. So I'm so pleased to announce that this year, well, we spent the last year and a half updating our training. It had been 10 years, and we wanted to be sure that we included things like the PONT standards, the new professional navigation standards, and that we had revised the training so that it reflected the evidence base, since we had gained a lot of knowledge and there had been a lot of research in the last 10 years. So as of March 1st of this year, we relaunched our patient navigation training. We also consolidated it from about 17 hours to 14 hours. We tried to make it more informed by adult learning theory and more interactive. So you can access it at this QR code or bit.ly on the slide. The bit.ly is bit.ly/PN training. But I am even more excited to tell you that on October 1st, we launched our fully translated Spanish version of the training. So I would be very excited to, our QR code didn't make it to this version. I would be very excited to find out from you all what you think of the training and if you have suggestions. What I've found with working with native Spanish speakers is that we've had a lot of conversations about how a word should be translated. So I am positive that there are some words that possibly we could have done better. But I also want to thank Nancy. She was one of our two speakers who delivered the content and partnered with us on this training. And I want to just emphasize that my hope for this training in 2015, and it continues now, is that I wanted to provide something free that didn't cost money, that would be accessible to people who were navigating, whether they were paid or not paid, and that would result in a certificate and a demonstration of getting through fundamental content. But our content is just that. We are starting with the fundamentals. We go through, well, I'll go through the categories of what we actually cover in just a moment, but there's still a need for specific context-based training, and that's where MPI comes in, that's where your institutions come in. But I hope this has served as a strong foundation for a lot of different contexts in terms of navigation basics. So I mentioned the content of the training, so a general overview. Oh, I'm sorry, I don't know how to get rid of that. Okay. So we cover cancer basics and the continuum of cancer care. We cover medical terminology, both kind of Latin roots and oncology-specific terms that a navigator would want to know. We also cover the navigation role. So I talked this morning about role and scope of practice. So we discuss that and cover that in our training. We talk about team-based navigation and role delineation. So how does this profession interact with the other members of the healthcare team? And then Unit 5 may be a little less interesting to you because it's specifically about the U.S. healthcare system for our navigators. This was built as a training for the U.S., so you might want to skip that section. And then professional development and ongoing practice-based learning, communication with patients and with caregivers, shared decision-making, patient advocacy, and addressing barriers. And then finally, ethics, patient rights, program evaluation and quality improvement. I can't even read that, clinical trials, and I can't even read that. Oh, value of patient navigation. See, my eyes are failing me. So I think you can tell that there's nothing in there that talks about a Colombian context, and there's nothing in there that talks about your institution's context, but it gives you some really great content as a foundation for knowledge. So hopefully this QR code will work. This is on the left is the English patient navigation guide. What I'll do is I'll make sure that Nancy has the bit.lys and the QR codes for all of the Spanish version of these. I had a placeholder and didn't make it into this. I also wanted to mention this. There was some discussion this morning about evaluation and Excel sheets, and this is something that I developed in 2017 with a staff member of mine who's now gone on to do great things. But this is a free evaluation tool, and it's actually based in Excel, but it's pretty robust. It kind of takes Excel to the limit that Excel can go. It has a place for patient identification information, time points, navigation barriers, navigation actions, and there are some automated reports that you can run. So you can download this, adapt it, translate it, do whatever you want with it. The biggest limitation is that this was done in 2017, and so I don't know what it will do with updated Excel software. And we don't have a technical team to kind of troubleshoot. So it's kind of at your own risk, but free of charge. If it can be a helpful starting point for your evaluation, it is available to you. We also created a training called Together, Equitable, Accessible, Meaningful. And again, this is fairly US focused, but we have a very diverse population in America, and we have some clear health disparities. And this training was specifically designed to try to equip healthcare professionals, including patient navigators, with some knowledge around African American disparities, Latino disparities, and LGBTQ disparities in the United States. So feel free to look at that. That's also free. Probably something tailored more to your context would make sense at some point. And these are my references that I mentioned, and again, how to stay in touch with me or contact me. But I will make sure that you get those links to the Spanish version. I was just over the moon to be able to announce that today. It's something a long time that we've wanted to do, and we finally were able to translate our entire training and guide. So thank you so much.
Muchas gracias, doctora Mandi.
Thanks
Invitamos
so
a la
much, Dr. Mandi. We invite Nancy Peña, co-founding director of NPI United States and Latin America.
Buenas tardes a todos de nuevo.
Good afternoon to everyone. How are you feeling after your lunch? Are you feeling energetic or are you feeling sleepy? Yeah, okay, excellent.
Bueno, voy a ver si funciona esto.
Let's see if this works. Yes, it does. Okay.
Entonces, pues ya
So
platicamos hoy en la
we already
mañana
talked
sobre un poco
early
sobre
in the morning
navegación
about
internacional
international
NPI, y
patient
como bien dijo
navigation,
la
NPI,
doctora Mandi
and like
Pratt-Chapman,
Mandi Pratt-Chapman
nosotros
said,
hemos trabajado
we have
más
worked
hace de 10 años
for over
y
10
vamos a hablar
years.
hoy también sobre la
And we will speak
capacitación y
also
certificación
about
de
training and
NPI,
certification
la cual sí está
by NPI,
tropicalizada
which is a little bit
para el contexto
tropicalized,
latinoamericano y
giving
que
our
muchos de
LATAM
ustedes
context,
aquí
and that
presentes
many of
también en
you
línea
here attending and
ya han
online
tomado el curso,
have
ya sean
already
capacitados,
taken the
certificados
course,
o
you've
están en el
already been
proceso
certified, or
de,
you are in the
de
process
graduarse
of
como
doing
NPI.
so.
Entonces, básicamente,
So
los
basically,
avances que hemos
the
hecho
advances
en
that
general, la
we've done in
organización,
general
para
as
darles
an
un
organization,
poco
just
de
to
dónde
give you a
estamos hoy
little
día,
bit of an idea of where
hemos,
we're at right now,
hemos tenido la
we
capacidad y
have
el
had
privilegio de realizar
capacity and the
material
privilege to go through
educativo.
educational
Nuestro
material,
material está
and our
avalado
material
y
is
también
endorsed
registrado
and
con las
also checked
universidades
by
pontificias,
the
la Javeriana, como
universities,
ya hablábamos,
Javeriana
la UNAM,
University
y hoy mismo
and
estamos
UNIS,
desarrollando un
and
curso
we are
para
developing a
concientizar
course to
médicos
raise
sobre
awareness
navegación de
in
pacientes
the
en Guatemala, junto
doctors
con el Hospital San
in
Juan de Dios, la
Guatemala
doctora
alongside San Juan de Dios Hospital and in the Istmo University. And also in this year, we have
para seguir trabajando juntos.
evolved the agreements with Javeriana and UNIS. We are here celebrating the second Congress of Patient Navigation. The first was in 2023. And we are also collaborating with Dr. Mandi Pratt-Chapman. She already mentioned this, where we are supporting, we want to record, tape the course in Spanish. And we are also partaking with several organizations, not only to raise awareness about navigation, but also to strengthen competencies and capacities, like we did in Philippines. I feel very proud and honored to tell you that this year, thanks to a pharmaceutical company, we developed the first breast cancer course aimed directly to navigators within our course. So apart from the navigation course, we have 6 extra hours for navigators to be educated and trained, especially in breast cancer patients. And we are seeing if we can do it with prostate cancer also for next year.
Entonces, el curso de navegación, este es un artículo que se
Navigation
publicó
course,
en la
this is an
Academia de
article published
Oncología
in the
cuando
Oncological Academy when we were starting, and this is due to what? That we didn't have this before, and you know this. People were looking for this material. Maybe there was some sort of degree or diploma, but there was no formal certification. We are the only organization in Latin America that we give both them training and certification. The same way, our course is an 8-month course in general. So people say that 8 months is a long time. In reality, it isn't. Why? Because the course is divided in theory and practice. Theory, we will have more than 20 online hours, and for this you will have around 2 months to pull it off. Then you will have an exam based in the Guide of Navigation by George Washington Cancer Center, which is well enforced, and you will have the extra breast cancer course that I was talking about. You also have to have an exam above 80% of success. And so why are we doing this? Because NPI is conformed by oncological navigators, clinical and non-clinical. For example, myself, I've had the privilege of having all my certifications in the United States. But the thing is that when you have the theory and you go back to practice, sometimes you don't know how to navigate or how to work with the clinic, with the hospital, or let's say how to coordinate with the multidisciplinary group several topics. And this is why practice with NPI is important. A 6-month period of practice where you as a navigator will deliver support for 3 or 6 months to a patient. We will hold meetings twice a month, and we will share cases and workshops. Without sharing information or databases, you cannot gather IDs. But the most important part of this training and this network is that we support each other as navigators. We listen to each other, we listen to our frustrations, to our happiness, on our sadness, especially when people sadly pass out. We are not only training, but we are humanizing ourselves and supporting us. And of course, when navigators become certified, they make part of the international network of people that are professionals. Of course, the principles of patient navigation and competence are based 20% in what George Washington Cancer Center said in their guide, but we're also working with the Oncological Academy for Nurses and Navigators and American Cancer Society. NPI makes a part also of the American Cancer Society Global Alliance for Navigator. What means? This means is that there were a great deal of countries that are looking to standardize the concept of navigation in Latin America, and we will see why. However, when navigators sign and agree to these competencies, even before starting the course and cite the competencies, they are very similar to what Mandi just said. but that have been also tropicalized to our region. And one of the main competencies is confidentiality of the patient, because usually we tend to have a great deal of trust with our patient, and sometimes we speak in the whole about patients. And so these details we take care of a lot.
Voy a darles unas
I'm going to
estadísticas.
give you some stats. And we heard that in the prior course there were over 10,000 navigators certified with the doctor. In our situation, we're not as many, but remember that we are the only organization. We started in 2020 and we have an 8-month course. Another thing is that our course is you have to pay for them. We granted some scholarships, 90 to be more precise, but we observed that they would not make the best of these scholarships. And so our course has a price. A great deal of pharmaceuticals are granting scholarships, and we can evaluate cases one by one to see if they can apply to have scholarships.
Hoy día, dentro de nuestro
Today,
curso, los
inside
navegadores han
our
capacitado
course, navigators have delivered support to 199 patients from 2022 to 2025. We've observed that the geography is pretty much rooted in Colombia, where we have the biggest number of navigators, in Guatemala, Mexico, Argentina. The profile of the patient usually is 71% are females, and the cancer types are breast cancer, colon, and cervix,
de pulmón y de próstata.
and the lung and prostate. We observe that the treatments that are most required are chemos, surgeries, and radiation.
De igual manera, las
The
barreras
same way, but the barriers that we've met are very similar in every single country. Basically, it's to get the medical appointments. This is 35%. Also, knowing what to do throughout the symptoms. How can I work through the symptoms and get medical results, which is a 20%, which is pretty high. Medical terminology is a barrier because people don't understand this vocab that doctors use. Also, the support, the psychological, nutritional support, the social support, this makes 15%, which is a pretty high figure versus psychology and nutrition. Also, the housing, we've observed that 74% have a stable house. However, 12% pay a rent and are afraid to lose their house, and 14% have really grave situations. What does the navigator do with patients? So we spoke that navigation is a barrier reduction process, but also an educational process and support process. What our navigators do is deliver education to the patient about their treatments, the resources within and outside the hospitals. We also refer our patients to other colleagues, such as psychosocial, palliative care. We answer questions beforehand. We try to assure ourselves that they are understanding what the procedures are. For example, in Costa Rica, our colleagues here, the metamorphosis. Where's metamorphosis? In Costa Rica, we had the privilege to speak with them and give some workshops, and they give a booklet, which is like a diary, a log, and they invite the patient to write their questions. And also we do the integration of relative support and friendships, because sometimes the patient comes by themselves and we need to establish that network. It's important to understand that navigators are not the sole source of support. We are not the sole source of support. And also write about the symptoms and coordinate logistical support with other suppliers. And to wrap it up, let's talk a little bit about some context about the voice of the patient. We have a patient that said that they didn't like to talk with the navigator before because it was losing time. But then when they proved that these support was valuable, they understood. This happened also in Costa Rica, what we were saying before. the patient assessor helps all the process to be more agile. They gave me a log where I can write how I feel and my questions. In Guatemala, we have a patient that says, the orientator of patients showed me the hospital and where my center was. I come from a rural place and I don't know the city. And so what I want to focus on, and this is why I put these blue letters in a different color, is the type of or the concept that people think when they think about navigators. The second says the navigator, the second says the assessor of patients, and the third says the orientator of patients. That's when we said, when we are saying that we want to standardize the concept because we are being given different names.
Y pues acá no vamos a revisar esto, pero
we are not going to go through this, but 100% of patients recommend us as navigators. And so really quickly, I'm going to share that we've had 101 navigators already certified and trained. We have more because we started ever since 2019, where we don't have database that goes that way back. So we are reporting our database from 2022 up to today, where the majority of navigators have been 89% female, 11% male, in between the ages of 26 and 50. And in the countries that we mentioned yesterday, Colombia is one of the leading countries, followed by Guatemala. Professions, we have nurses, 59% already graduated, most of them from this university and others, and other universities. We also have volunteers, we have nurse assistants, and clinics and hospitals are private or foundations.
Dentro de esta estadística que
Within
hemos
these
visto,
statistics, these figures, this is the opinion about formation models. 71% valued positively the combination of practice and theory. 42% pointed the importance of educational chats. 63% was well satisfied. 100% recommends navigation, and we've had people asking for other subjects. And to end it, the next steps of NPI to keep expanding navigation, and this is why we are having these sort of events, and not just here. NPI is partaking in many different chats. We are being invited on a yearly basis, and we invite people also to educate other organizations. If you are interested in having us in whatever chat with no profit intended for your organizations, we will give you this opportunity. We are also creating strategic alliances. We are developing tropicalized courses according to the region and the necessities and the needs, and we are promoting NPI on a global level also. This is the photograph of some of our navigators that have graduated, and also our team. Thank you very much.
Solo vamos a, me ayudan a poner este video.
Let me run this video, and this is how I say goodbye. This is the testimony of a navigator of us.
My name is
Deyanira Zúñiga. I am the president and the founder of the Metamorphosis Association. Hemato-oncological patients from Costa Rica. Right now, I'm a student of the psychology program in the Catholic University of Costa Rica. The training from Navigation International has been quite enriching because of that, the human sense that we have so close to the patient. It's a big learning because in spite of the fact that we have already been volunteers for a few years, it provides us with tools, practical tools in a very well-structured framework to understand better the process of a patient navigation because it helps strengthening that knowledge that we acquire along our life as volunteers. And also it helps to create skills to support in a more effective manner both the transit that they have or the journey throughout the different hospitals as outside, because it's not just about the hospital, but also this knowledge that we provide patients with, and patients that, from rural areas that are mainly the ones that we see in the hospital that we are located. What we have learned, we are applying that directly in the San Juan de Dios Hospital. That is one of the oldest hospitals, the first one and one of the biggest. We have also an important barrier that is the transit, the one that we have almost 3 kilometers, and so moving to different areas. And in that way, that has helped us to something that can contribute to that communication that we have, that has helped us to identify the barriers that also the patients have in that system of social security, and has allowed us to accompany not only us, but also the communities that has been guiding us with communities, users, and their families about the different resources that they have both in the hospital and in our organization and our peer organizations, reinforcing the continuity of care and the emotional support of both caregivers and patients. I have recommended 100%, and I will continue to do patient navigations and NPI because it provides an organized model and people-centered, which is very important because it will facilitate the access to the health services through that training that we get as navigators. I am very happy having achieved that. This is something that we have had for quite a few years, and fortunately it flourished this year. And well, we have worked together with different colleagues that today are here from Costa Rica, and that has been enriching. Also, by facilitating access to health services, this will reduce inequalities. We are looking for equity or equality in the services in the rural areas, and strengthening the support networks. Also, it significantly improves all these processes, the patient life, which is the most important part, and it optimizes the coordination that we need to have as volunteer navigators with the different professionals, which is key for that comprehensive healthcare of people with lived experience as we. And that process they are going through right now are where they need to be supported. And this is why I want personally to thank Nancy, who accepted the invitation to come here to see firsthand what we do in our hospital with that big knowledge of the patient journey that we had in the different departments. The entire team that is with her in this great project. All the colleagues that are graduating today, also congratulations in all the different countries to all the team of speakers. And I close with the slogan that we have in our program that is called Support to Cancer Patients, that now allow us, and we are with that freedom to call ourselves international navigators. And I close with it. That is, your struggle is different to mine, but let me guide you through it.
Muchas gracias,
Thank
Nancy,
you very much, Nancy, for sharing this testimony with us.
Nos acompaña
We are now with Nurse María Eugenia Rodríguez, professor of the nursing school, Javeriana.
Para el conversatorio. Entonces, María Eugenia tiene la palabra. Tenemos el micrófono para las personas que del
María Eugenia
auditorio
have
que
the floor,
quieran
so we
realizar
have the mic
preguntas y a
open
través
for
de
the people
su,
in the auditorium. Apologies
conexión.
for that. Okay.
Muchas gracias. por la
Thank you very
invitación. Me
much
siento
for
muy
the
contenta y complacida
invitation.
de estar
And
aquí
I'm really
muy
happy and
acompañada
pleased to be
con
here in such
Mandi,
a good company.
licenciada
Dr.
Nancy.
Mandi, Dr. Nancy.
Bueno,
Well,
sabemos que
we
cuando
know that when
llegan los
we
diagnósticos como el cáncer
when there are
a la
diagnoses
vida
such
de
as
las
cancer
personas,
and
hay un
they
cambio
arrive in
significativo
people's
en
life, there
todo
is significant
su ser,
change
¿cierto?
in their
Desde
entire
aspectos
being, from the
sociales,
social aspect,
emocionales,
emotional,
económicos,
economic.
y
And
es muy difícil
it's
para esta
hard
persona y para su
for those
familia
people and
transitar
for their
en este
families
largo proceso, ¿cierto? Todos
to
conocemos
navigate
que
through
son
that long
enfermedades
process because
crónicas
we know
que
that
van
they
a
are chronic
tener un
diseases
largo
that
recorrido.
will have
Entonces,
a
qué
long
rico poder
journey. So
encontrar en este
it's
camino,
really good
pues,
being able to
estas
find along
personas
that way
y
those
a todos
people
nosotros que
and
formamos
all
un
of us
equipo
that are
integral
part of this
para hacer ese
comprehensive
acompañamiento y
team
caminar al lado del
to provide that
paciente,
support and walk along the
pudiendo
patient,
buscar esas
being
barreras y
able
pudiendo
to
gestionar
help them overcome those
esas
barriers and being
barreras
able to
para que
manage
los
those barriers so
pacientes
that they
puedan
can
tener
go
una
through
mejor adherencia y unos mejores
and have better
resultados.
adherence and better outcomes.
Bueno, yo
And
veo
well,
que el
I see
curso
that
ha sido
the
bien
course
pensado
has been
desde una
really well
necesidad,
thought.
no existía,
From
no
a
lo había,
need, it didn't exist, we didn't
encontrar
have
pues
it.
todo
So
evaluar
it's
esas
been really good being able
competencias,
to
buscar
find
todo ese
all those
soporte
skills,
científico para
competences,
poderlo
seeking
desarrollar
for
y
the
sobre
scientific
todo
support
pensar
to
en
develop
buscar
that,
esos
and
dominios,
especially
como
trying
lo
to find those
mencionaba, desde el aspecto
domains
ético,
from the
desde el aspecto de
ethical
conocimiento, la
side, knowledge,
multidisciplinaridad, del sentido de
interdisciplinarity,
liderazgo,
leadership,
desde la prevención y el tamizaje y otros que
prevention,
mencionaron,
screening,
pues
and
es
others
importante
that
porque
have been
realmente es lo
mentioned
que
is
nosotros
important
hacemos
because
también con los
that's what we
pacientes y sus
do
familias.
with
Pues
patients
bueno,
and their
son las
families.
competencias que nosotros
Those
debemos
are
tener.
the skills and
Conocernos
competences
del,
that we
del
should
proceso
have.
cáncer
Getting
desde
to
sus
know
aspectos
from what
básicos,
cancer
pero
is from
también
the
conocer
basic
qué hace el
aspects, but also
navigador,
getting
qué
to
es lo
know
que
what the
hace, cuál es su
navigator
responsable
is and what
y
is it that
darle
they
ese
do.
valor y la
What are their
importancia
functions and
a
give it
ese
that
proceso.
value and that relevance to that
Entonces,
process.
y aún más,
And even more,
pues agradezco también pues
I
que
also
también se haya
want to
diseñado
thank
para
that
Latinoamérica,
is
para
now has
nosotros
been thought
los
for Latin America for
hispanohablantes,
us
¿no?
Spanish speakers.
Entonces
Thank you.
poder hacer
So
esa
being able to
tropicalización,
do that
porque sí, muchas de las
tropicalization
barreras que
because
tenemos acá en
a lot of
Colombia
those barriers
también
that we
están
have here in
relacionadas con
Colombia and
Guatemala,
also
Costa
related,
Rica y
similar to the
demás.
ones in Guatemala,
Entonces
Costa
poder
Rica,
pues
etc.
también
And
identificarlas y
being able
poderlas
to
trabajar.
identify
Y pues poder
them and
expandir
work
también la información,
around them.
como lo decían,
And
es el
also being
segundo
able to
congreso que
expand,
hay.
disseminate the
Entonces,
information. This is the
a mí
second
de
Congress.
poder
So it's
expandir
wonderful
incluso
being
para los
able to,
médicos que están haciendo en
for
Guatemala,
example, now
poder mostrarnos
in the
pues desde,
paramedic
tú decías, 8
courses
meses,
that they have in
pero realmente
Guatemala.
viendo el
Because
campo
I
de
mean,
uno,
looking at the
pues
content,
se
I
hace
mean, it's
desde lo
just
teórico
8 months,
práctico,
but
realmente es
everything,
muy
I mean,
fructífero.
is
Ujú.
is very, very
Y
useful. And
además, pues el apoyo no solamente para las
in
familias
addition to
y los
that, the
pacientes, sino que
support is
también
not only for
nosotros
the
como
families and the patients,
profesionales
but
de la
also for
salud
us as
es
clinicians in that
interdisciplinario. Entonces, para mí
interdisciplinary
es
team. So
maravilloso
it's
y los
wonderful
resultados van a darse
because the
en la adherencia
results or the
que se
outcomes will
crea
come from the
en el mismo
adherence
sistema de
from that
salud
healthcare,
y pues
and
a
it
nivel
will be beneficial for the
civil,
health
a
system
nivel de
eventually, yeah, in terms of
mortalidad a
numbers,
nivel mundial. Entonces, me parece
mortality
maravilloso.
around the world. So thank you very much.
Tenemos una pregunta para Nancy.
We have one question for Nancy.
Hacen una mención a una excelente presentación.
They said
Y
very
la
good
pregunta es, ¿se
presentation.
ha pensado
And the
en
question is,
capacitar
have you
profesionales
thought about training
de forma distinta
professionals
técnicos voluntarios?
different in a different way to those technicians or volunteers?
Sí, de
Yes,
hecho,
thank
ahora
you.
mismo estamos
Actually,
con esta
right now we are with
capacitación
this
para médicos, ¿verdad? Porque
awareness
sabemos que la navegación
training for
necesita
doctors
expertos
because
médicos
we understand that navigation needs champion doctors. We're going to talk about that tomorrow.
se capacite
And
no
it's
solo
important
a
that we
los
train
médicos, sino al
not
staff,
only
al staff
doctors, but also the
administrativo.
administrative
En el
staff
proyecto de
in
navegación
the
que
patient
nosotros
navigation
tuvimos en el
project that
primer
we
performance
had
y que vamos a trabajar con el ingeniero
in the first
que
one,
mañana va a presentar la
performance, and
doctora
that
Sarah,
will be presented by Dr. Sarah
inició
Falmont
el
tomorrow.
proyecto
When we started with the
y pues era
project, it
solamente
was
los
just
varones
our
y
team
obviamente yo.
and of
Pero
course
después entendimos
myself,
que
but
si
then we
el
understood
resto no
that
entendía la
if the
logística,
other
¿verdad?
people didn't understand the
Secretarias,
logistics,
asistentes
even
médicos,
secretary,
residentes,
medical
doctores,
assistants,
ajá.
residents,
Si
doctors,
ellos no
sergeants, etc.
entendían esa logística,
They don't,
ahí habían
if they didn't
barreras.
understand those
Entonces el
barriers, we would
programa,
face barriers.
la manera
So
que
the
lo diseñamos fue
way that we designed
capacitar,
the
educar a
program was to
cada uno
train and
de las
educate
personas
each and every one of those people involved in the patient journey. And that gave us wonderful results. So the answer is, yeah, it's necessary to train the entire staff. And answer two, is that we will have now this awareness raising for doctors, but it's important to make aware and train all staff.
Bueno, hay otra pregunta con relación
Well, there's another question
a-
about
al cuidado que se debe tener
the
con estas personas,
care that
pues
we
con las
need to provide with those people, taking
refiriéndose
care
a
of
los
the caregivers, talking
navegadores
about the navigators,
de pacientes,
yes, of
que
patients,
son quienes hacen
caring for the
¿Cuándo
caregiver.
o cuáles son
You
las
know,
propuestas
what
para
are the
los
proposals for
navegadores
the
para bajar
navigators,
la carga,
also
para
to
disminuir la
reduce the load, stress, etc.
I guess I can speak to that generally, but I think that Nancy could probably speak to this better in context. I think the navigator role, as Nancy mentioned, is not working in isolation. So the navigator is trying to create some order out of what feels very chaotic in helping the patient write down questions, helping the family understand what's to come, and the caregivers in the family play a critical role. They're the ones that are there all of the time, and there's been a growing field of caregiver research, actually, because we do recognize that we need better programs for caregivers. I think, personally, I think it's challenging because I'm not sure if the healthcare system is the perfect place to do that. Since we're already busy with patient care, but there's clearly a very significant need for caregiver support. So I think a lot of smart people are trying to think about this and trying to think about ways to better support caregivers. Without a doubt, they're the biggest care force that we have.
Thank you, Mandi. Sí, por ejemplo, en NPI nosotros cuidamos mucho al navegador.
PI, we care a lot for the navigator, and that's one of our strengths, I think. Because, of course, as I repeat, we are navigators. We understand that emotional burden that we get, also the volunteers, because you also guys get those sad news and things like that. So what we do in MPI is that the navigator needs to have a program with the process of taking care of the patient about he or she will take care of themselves. So, and we transmit that, we convey that to their families. One of the latest talks that we have in NPI with the navigators is not to present cases, but the question is, what do you as a navigator do to take care of yourself? And that's something that we have fully understood, because we need to know what is it that the navigator is doing to have that kind of catharsis and not to have that overload and taking care of themselves. Because if you don't care of yourself, you cannot take care of anybody. And if you don't know how to take care of yourself, you don't know how to take care of somebody else.
Muchas gracias, Nancy.
Thank you very much, Nancy. Yeah, we have a question from the audience.
Bueno, muy interesante. Muchas
Very
gracias.
interesting. Thank you very much. Because actually, recognizing the caregiver is very valuable, the formal and the informal caregivers. And having those programs, those tools, and those guidelines, will allow us to do that. Taking care of myself to be able to take care of others. Yeah. Thank you. Question for Professor Mario Eugenia about the nursing school faculty here in Javeriana. How are you including navigation within the curriculum? Yeah. We, in all the context of navigation, we work with that because we know that those skills are required to be able to take care of and to support the process. So within the curriculum, you will see some important relevant aspects related to that within some of the subjects related to navigation. So in addition to that, we also provide support to NPI for that validation of this class, for example. Yeah. So we do manage that, and we provide the opportunity to the students so that they can also do that navigation classes. The idea is that we are all trained, and the idea is for all of us to work as an interdisciplinary group, not only as nurses within this process of navigation. And I want to complete with what Maria Eugenia said, as Nancy mentioned recently, and now Sandra is going to talk about that in a moment. The university signed an agreement with MPI in 2023 This year that agreement was renewed, and we have trained 60 patient navigators, a master's degree in oncological care and in the multiple program that we have with that palliative care, so that graduates can obtain the certificate in addition to the diploma as a master's. They have that certificate on navigation through formal curriculum that we have created together with Javeriana University Nursing School and NPI, basically with Nancy Peña. And here, there's a question. Yeah, there's another question from the audience. Okay, okay.
Perdón, antes de que solo quiero
Apologies, I
complementar.
just want to complement something also.
Obviamente apoyar, hacer eco.
I want to support and echo what Dr. Carmen Lucia said.
Y también nuestro currículo también está
And
revisado
also
por la
our
Universidad de
curriculum is
Licda,
reviewed
Guatemala,
by
en
the
la
Licda University in
Facultad de
Guatemala
Medicina.
at the medicine
Entonces,
school.
esos
So
ambas
we have those
evaluos y revisiones,
both
anuales.
assessments and annual reviews. Yeah.
Sí, yo también quería complementar
Yeah, I
algo,
also
y
wanted
es
to
que,
complement, and is that the
del curso de navegación
curriculum of
fue
the
adaptado,
navigation course was
digamos, para nuestros
adapted
estudiantes, está
for
adaptado
our
para que
students,
conozcan muy bien
for you
el
to get to
sistema
know
general de
very well
salud
the general
de salud
system
en
of
Colombia.
health in Colombia.
Y eso es una parte. Y
And
lo
that's
otro es
one
que
of the
no
things.
es
And the other thing
solamente
is that it's not
teórico,
only
sino que los
theoretical,
estudiantes
but
tienen,
that students
se vuelven,
become
pacientes,
or they have
y
a
eso es
patience.
teórico práctico.
And so
Entonces,
it's
realmente eso es lo que lo hace
theoretical and
sólido,
practical. So
y
that
también yo
makes
creo que es
it
lo que nos
solid.
está,
And
que
I think is the
acaba de
one that
mostrar Nancy sobre
you
las
just showed,
estadísticas de
Nancy,
satisfacción,
on the
y que 100%
satisfaction
recomienda el curso.
statistics,
Quería
and I
complementar eso.
100%
Muchas
recommend
gracias.
that. Thank you very
Muchas
much.
gracias, Esperanza.
Thank you very much,
Tengo
Esperanza.
aquí
I have over here. Go ahead.
Claro, como
Yeah,
para
and of
finalizar
course,
y
and to
cerrar,
end and to
como el ejemplo va
close,
desde casa, los
since
profesores
example comes
también,
from home, professors,
los que estamos
also the
dictando,
ones that are teaching this
algunos estamos
curriculum.
programados para
Some
iniciar el
of
curso,
us,
pero
we are
la mayoría de
scheduled
los
to start
profesores
this,
están
but
certificados
also
en el
the
curso de
teachers are
navegación.
certified in the navigation course.
Gracias.
Thank you.
Bueno, hay una pregunta.
Well, there is
Primero
a
nos
question.
felicitan,
First, we
por
get
estar buscando
congratulations for
obtener
trying
esta
to find
importante certificación.
for trying
Y
to
dice,
obtain
obtener la
this important certification.
normalmente
It
se
says
traduce en una
obtaining
mayor
this
compensación o
certification
reconocimiento
is
para los navegadores.
usually recognized in better compensation for navigators or recognition for navigators. Yeah.
Sí, bueno, recordemos que el doctor Freeman, tanto como la doctora Mandi
Let's remember that Dr.
hablaron
Freeman
con los
and Dr.
Estados
Mandi
Unidos
Shannon, they talked
de
that
hay
in the United
reembolso
States, there
para
is
el
actually
servicio de
a
navegación.
reimbursement or payment for the
Aquí nos toma
navigation.
30 años.
Here, it took
No
us
ayuda.
30 years, right? 30 years. Because, yeah.
Entonces,
So,
pues recordemos que nosotros estamos aún iniciando
let's
con este
remember
proceso.
that we are
Es un
just
concepto que
starting with this
muchas,
process. It's still a new
muchos
concept
países.
in many
De hecho,
countries.
estamos trabajando muy de
Actually,
cerca con
we
el
are
Ministerio
working
de
hand in
Salud
hand
para que se
with the
reconozca,
ministries of
para que se
health
reconozca.
so
Por
that
ejemplo, en
it is
Guatemala
recognized. And what is
ahora mismo
recognized in
trabajamos con
Guatemala?
el Ministerio de Salud
We
que
are
está
right
muy
now working with the
interesado
Ministry of
en
Health, that
hacer
they are very interested in
institucionalice la
institutionalizing
navegación y contratar
navigation and
navegadores.
hiring navigators.
Entonces, eso sería
So that
una
would
cosa que
be
también Global Health
one thing that
Society,
also
perdón, el Global
Global
Alliance for Freight
Alliance
Transportation Navigation, la
for
organización que
Patient
yo mencioné,
Navigation,
que
the
es
organization that I just mentioned.
Universidad Javeriana,
Actually, the Javeriana
forma
University
parte de
is
ese
part of
proceso.
this process.
También la Universidad de México,
Also, the Mexico
el
University
ICANN de México y otras organizaciones.
and other
Lo que estamos
organizations. What
buscando
we
acá
are
es,
looking for or
obviamente
aiming
no
here,
podemos hacer cambios
of course, we
institucionales
cannot
en los países, no
generate
podemos. Sí
institutional
podemos
changes in
dar
the countries. We
herramientas
cannot,
y
but we can
podemos
provide the
concientizar
tools,
a
and we can
los
make aware
líderes
those
del Ministerio de
leaders
Salud
of
para que
the
empiecen
health ministry so that
a
they
pensar, como dijo el
start to
doctor
think.
Freeman,
Dr. Freeman
mostrar
said
estadísticas es
in
importante,
showing
¿verdad?
statistics, which is
Si
important,
no lo escribe, prescribe.
because if
Si no escribe,
it's not
prescribe. Entonces, si
written,
solo
if
contamos qué fue lo que
it
pasó y cómo ayuda al paciente, pues
prescribes,
eso es un cuento
I mean,
y ahí
that's
se murió. Pero si tenemos
that would die.
estadísticas y
Because if we
podemos ir
have
predeciendo,
statistics,
como dijo el doctor
and we
Freeman,
will
y podemos
analyze in health,
mostrar
like Dr.
cómo
Freeman said, and
podemos
we
ayudar
can
a reducción
show
de barreras
reduction
y
of
reducción
mortality,
de
reduction of barriers, and
porque
actually
mientras
cost
más
reduction,
reducción de
because
barreras
the
y de
more reduction
hospitalizaciones
of barriers
clínicas
and
y emergentes,
admissions
esa
and
es una reducción
admissions in the
para
ER,
los
that is a
pacientes,
reduction
es
in
una
costs
reducción
for
para
the
la
hospitals, for the
administración.
ministries of health,
Entonces, el Ministerio de
and
Salud
for the
tiene
health
mucho
system. So
lenguaje
the
que ellos van
Ministry
a
of Health,
utilizar,
of course, the language that they're going to use,
dinero.
it's about money.
¿Cómo me ayuda a bajar
Okay,
costos?
how can you help me
Para eso
reduce
dinero lo vamos
costs?
a reinvertir
and how that money is going to be reinvested somewhere else. So that's the strategy and the language that we as organizations should take to, or take to make aware and to support organizations such as Colombia and other countries to have that language and to scale, go up to those Ministry of Health so that they know how to present navigation and present the benefits for the patients, but also for the Ministry of Health.
Muchas gracias,
Thank you.
Nancy. Y hay una última pregunta. Ah, bueno, también tenemos
And there
otra
is
pregunta,
a
pero
final question. So we have a final question, and
dice,
this says,
cuando ya no se está vinculado
when
con una institución
you are no
hospitalaria,
longer
¿cómo se puede
connected to a hospital
realizar educación
institution,
continua
how
y
can we
ofrecer,
provide continued
perdón, y obtener
education
la
and
certificación para
obtain
poder
the
ejercer?
certification to be able
Sí, esa
to
pregunta es bastante regular.
exercise
A
or
veces
work? Yeah,
tenemos
that's a quite common
personas
question
interesadas en
because
sacar la
sometimes we
certificación,
have
pero
people
no están
interested
trabajando en un
in
hospital,
getting the
¿verdad?
certification, but they are not
Entonces, lo que
working in a
nosotros
hospital or
sugerimos
in a
es que
clinic.
si esta persona
So what
primero
we
tiene que tener un
suggest is
perfil, ¿verdad?
this person needs to have a particular profile.
Su currículo,
Yes, they need to have a curriculum. We need to actually check that they actually are trained to be navigators. And then we try to support them and connect them with some NGO legally registered that legally supports cancer patients or patients with other diseases so that they do the 6-month volunteer work. But that's quite rigorous criteria because let's remember that working with patients is a privilege. Is a privilege. So we need to be quite strict and jealous about who actually is going to come individually to becoming a navigator. It doesn't mean that they cannot do it, but it means that we as an organization, we have standards and protocols, not only to take care of the patient, but also to take care of yourself and ourselves. So we have quite a strict profile that we check case by case. Thank you.
Gracias, Nancy. Eso también
Thank you,
responde a
Nancy.
dos
That also
preguntas que hay
responds to other
en
2
el
questions
chat
that we had in
que
this chat,
tienen que ver exactamente con
and they are actually related to
antes
this.
de invitarlos a tomar un
Before
café,
inviting you
está
to
lloviendo
have
bastante
coffee,
fuerte,
and it's
entonces
actually
no se
raining,
puede
so you
ni en el
cannot escape.
escritorio ni
You know,
de
you cannot leave the building. So I want to
alusión a una información que pues,
also
queríamos
mention some information
compartir
that we will
desde
get tomorrow
AstraZeneca, pero
from AstraZeneca,
nos pidieron que hiciéramos
the
una
pharma,
adelanto de
but we
información,
would
y es
like
que
to give you
el
a
7
preview,
de
and it is
noviembre
that on
vamos a
November the
tener
7th,
un gran
we
lanzamiento
will
por
have a
parte de
great launch
AstraZeneca con una
that is
propuesta muy
gone
importante
by
que se va
AstraZeneca
a
with an
realizar acá
important
en la
proposal.
universidad,
It's
en
going
el
to be carried out
auditorio
in the university in
Marino
the
Troncoso
Marino
desde
Troncoso
8 de la
Auditorium from 10
mañana,
to 11 in the
y
morning,
todos están súper
and you
invitados.
are invited.
Mañana tendrán más información.
Tomorrow you will have more information about that. It's a surprise. So now we invite you for a cup of coffee, and I'll see you here in 15 minutes. We'll have time to watch the posters and a little bit more networking. Yes, you leave the building at your own risk because it's raining. Cats and dogs. Thank you.